Welcome to the Explainer. So, today we're tackling a topic that, honestly, sends an absolute cold shiver down the spine of pretty much any guy out there. Picture this. You're in the shower, or maybe just changing after a heavy workout, and you feel it. A lump, a swelling in your groin or scrotum. Instantly, your mind races to the absolute worst-case scenarios, right? Well, take a deep breath. Seriously. Today, we are going to completely clear up the confusion and give you the exact medical answers you need to figure out what's actually going on down there. First things first, finding a lump triggers immediate heart-pounding concern. And you know what? That is a completely valid, totally normal reaction. But I want to reassure you right out of the gate, you are absolutely not alone in this. Millions of men, literally millions, deal with this exact same worry every single year. Usually, the two most common culprits are a varicocele and an inguinal hernia. Now, at first glance, they can look and feel remarkably similar, kind of like twin troublemakers. But under the hood, they are very, very different medical conditions.
Okay, let's dive into this. To really put your mind at ease, just look at the raw numbers here. Somewhere between 15 and 20% of all men will develop a varicocele at some point in their lives. That's up to 1 in 5 guys. And when it comes to inguinal hernias, men face a massive 27% lifetime risk. So if you've recently found a lump, statistically speaking, you've likely just stumbled upon one of these two incredibly common, highly treatable issues.
So, let's break them down, starting with the varicocele. A varicocele is essentially an enlargement of the veins inside the scrotum. It happens in a specific network called the pampiniform plexus. If you're trying to picture it, think of it exactly like the varicose veins some people get in their legs. The valves in the veins malfunction, and blood just pools up instead of properly flowing back to the heart. Now, interestingly enough, 85 to 90% of varicoceles happen exclusively on the left side. Why? Well, it's basically a bad plumbing issue. The left testicular vein connects to the renal vein at a sharp 90-degree angle, which naturally creates much higher pressure. It's also incredibly common in younger guys, typically showing up between ages 15 and 25.
Now, let's completely switch gears and contrast that with an inguinal hernia. This is a totally different mechanical issue. An inguinal hernia happens when tissue, which is usually a piece of your actual intestine, literally pushes through a weak spot in your lower abdominal muscles near the inguinal canal. Unlike a varicocele, which is just swollen, lazy veins, a hernia involves your internal abdominal contents physically pushing outward. Because of this, it carries completely different medical risks, like the very real possibility of the intestine getting trapped, or worse, having its blood supply cut off.
Now, you might be sitting there thinking, great, I'll just figure out which one of these I have and be done with the whole shebang. But here is a fascinating and honestly tricky little detail. Having one of these conditions does not magically protect you from having the other. In fact, a 2023 study in the Journal of Urology found that among men undergoing groin surgery, roughly 3 to 5% actually had both conditions present at the exact same time. Absolutely wild, right? This is exactly why playing internet doctor and self-diagnosing will only get you so far. A professional medical evaluation is absolutely crucial.
But how can you start to tell them apart yourself? Well, the texture is a massive giveaway. Urologists famously describe a varicocele as feeling like a bag of worms. It literally feels like a little bundle of tangled spaghetti sitting just above the testicle inside the scrotum. An inguinal hernia, on the other hand, feels entirely different. It usually presents as a smooth, distinct, single bulge. It's often located a bit higher up in the groin crease, though it definitely can extend down into the scrotum. The actual type of pain you're feeling is another major clue. A varicocele usually causes this dull, heavy ache. If we're looking at a pain scale of 1 to 10, it generally sits at a very manageable, though super annoying 2 to 4. It just feels heavy. A hernia, however, is a different beast. It often brings a sharp, sudden, or even burning pain, particularly when you are lifting heavy objects or bearing down. If it's a sharp pain that suddenly catches you off guard, you're almost certainly looking at a hernia.
Your everyday movements are also fantastic tools for self-assessment. Let's do a quick comparison. If you cough hard and the lump doesn't really change at all, that points straight to a varicocele. But if you cough and a visible bulge forcefully pops out, that right there is a classic hernia symptom. When you lie down flat on your back, both might improve, but a hernia bulge will often disappear completely as it drops back into the abdomen. And finally, standing. Standing all day will make a varicocele feel way heavier and achier by the evening, whereas standing will literally cause a hernia bulge to actively appear because gravity is pulling that tissue straight down.
To put all this into perspective, let's look at a real-world case study. Meet Marcus. He's 34, and he noticed some scrotal swelling right after hitting the gym. Now, because of exactly where the swelling was, he was 100% convinced it was a varicocele. But during his exam, his doctor noticed the swelling completely vanished when Marcus lay flat, and then it popped right back out when he was asked to cough. That cough impulse? Dead giveaway. An ultrasound confirmed it wasn't a vein issue at all. It was an inguinal hernia. He went in for a minor surgery and was fully back to normal in just 2 weeks.
So, how does a doctor actually confirm without a doubt what's going on? They use highly specific imaging. To confirm a varicocele, they'll order a scrotal ultrasound with Doppler. The Doppler part is absolutely key because it actually shows the doctor the exact diameter of the veins. They're looking for anything over 3 millimeters, and it proves whether the blood is actively flowing backward. For a hernia, they'll order a groin ultrasound to literally watch the tissue move through the inguinal canal in real time. This is why it's so vital to communicate your exact symptoms clearly so your doctor orders the right type of ultrasound right off the bat.
Okay, I need to pause right here and shift gears for a second, because we really need to talk about emergencies. While most groin lumps are absolutely not life-threatening, there are a few major red flags you cannot ignore. If you ever experience sudden, severe pain down there, if you have nausea and vomiting along with the swelling, or if you have a bulge that you suddenly cannot push back in, you need to go to the emergency room. Immediately. Do not pass go. These are warning signs of serious conditions, like a strangulated hernia or testicular torsion, which literally means tissue is actively losing its blood supply. Seriously, don't wait on these.
Let's talk about what happens next if you do in fact have an inguinal hernia. The hard truth here is that hernias do not heal on their own. The physical hole in your muscle is not going to magically close up. While some doctors might suggest a watchful waiting approach for tiny hernias, the data is pretty clear. 70% of men who choose to just wait it out eventually end up needing surgery anyway. But hey, the good news? It's usually a remarkably quick, straightforward outpatient procedure using a tiny piece of mesh, and most guys are back to desk work in just a week or two.
Now, contrast that with managing a varicocele. Unlike hernias, many varicoceles actually don't require surgery at all. Treatment is usually done in stages. Step 1 is often just watchful waiting, basically keeping an eye on it to ensure it isn't messing with your testosterone levels or your fertility. Step 2 is a lifestyle adjustment, specifically using supportive, cooling underwear to manage the daily pain. And step 3 is surgery, like a microsurgical repair. It's incredibly successful, sure, but it's usually reserved for men experiencing actual infertility, severe pain, or testicular shrinkage.
So, the absolutely crucial point here is understanding how to manage that day-to-day varicocele ache if you're in the camp that doesn't need surgery. It all comes down to your underwear, and you have to understand the vital medical difference between compression and constriction. True compression provides a gentle, uplifting scaffold. In fact, clinical studies show proper graduated compression actually improves the velocity of venous blood return by a whopping 31%. Contrast that with constriction. Think tight, cheap synthetic briefs. Those literally squeeze the veins, trap massive amounts of heat, and actually make that stagnant blood pooling so much worse.
And that brings us to a really fascinating myth we need to bust right now. For decades, guys were told, hey, if you have a varicocele, just wear loose boxers to let things breathe. Well, the science shows this is totally wrong. Because a varicocele relies entirely on gravity to pull the blood, loose boxers offer absolutely zero support. They still allow your scrotal temperature to increase by a full 1.2 degrees Celsius just because of that stagnant pooling blood. But a purpose-built, supportive pouch, it keeps the temperature increased to a tiny, negligible 0.3 degrees by actually holding the anatomy up and actively assisting that blood flow.
If you're going to use underwear as an actual medical management tool for varicocele pain, these are the exact specific features you need to be looking for. First, you want an anatomical 3D pouch so you aren't constantly sitting on yourself. You need moderate compression. We're talking around 15 to 20 millimeters of mercury to actively counteract gravity. This is a total game changer if you have a standing job or sit at a desk all day. And finally, you absolutely want moisture-wicking, breathable fabrics like bamboo or modal, combined with cooling mesh. This totally prevents the heat buildup that damages sperm and causes that heavy, throbbing ache by the time you clock out for the day.
Which brings us to our final thought for today. Finding a lump is scary. There is absolutely no denying that. But rather than letting it be this dark cloud of endless anxiety, try viewing it through a different lens. As we've explored throughout this explainer, whether it's a hernia needing a quick, simple repair or a varicocele that you can easily manage with specialized support or minor surgery, you have highly effective options. So ask yourself, is this lump just going to be a source of worry? Or is it going to be the exact catalyst that empowers you to finally take proactive control of your reproductive and overall health? The choice is entirely yours, and the solutions are literally right in front of you. Thanks so much for joining me on this explainer, and I will definitely catch you on the next one.